هسه واضحة؟ واضحة. Before starting with the diseases of the venous system, we have to learn something about the anatomy and the arrangement of the venous system in the upper and lower limb, specifically the lower limb, which is more vulnerable for the venous system diseases. As you know, the arterial blood flows through the main axial arteries of the upper and lower limbs before running or returning via the deep and superficial veins of the lower limbs and upper limbs. Also, all of the veins in the upper and lower limbs are arranged in a superficial and deep system, which contain valves that ensure the blood flow toward the heart. The superficial venous trunk and the legs are two systems: the greater or long saphenous vein and the lesser or short or small saphenous veins, which lies above the muscle fascia of the limb. تعرفون الvenous system in the lower limb are deep system اللي هو started with the soleus plexus and gastrocnemius plexus and continued at the popliteal vein, while the superficial veins, which is the greater saphenous vein and the lesser saphenous veins, they are located outside the muscle fascia, between the skin and the facial envelope of the muscles. In the calf and the thigh, there are a number of valve perforating veins. These systems, superficial and deep system, are communicating between each other by a communicating vein called perforators that perforate the fascia to connect the superficial and the deep system at specific sites. The physiology of the blood flow. Blood enters the lower limb through the femoral arteries before passing through the arterioles into the capillaries, which have about 2 millimeter mercury at the arterial end. Pressure is reduced along the course of the capillaries, and approximately 12 millimeter mercury at the venular or the venous end of the capillary. The pressure continues to fall in the main veins, and it is as low as 5 millimeter mercury at the upper end of the vena cava. طبعا كلها venous drainage usually terminated in the vena cava, which return to the right side of the heart, namely the right atrium. The venous pressure at the foot vein is calculated by or equivalent to the column, the pressure of the height of the column of blood extending from the heart to the foot. يعني هو عبارة عن the pressure بالفوت نحسبه مو يعني العمود، طول عمود البلاد من الهارت للفوت، فهذا طول العمود من الهارت عمود طويل. It will create a high pressure on the foot, usually approximately to 100 millimeter mercury. To negotiate this اللي هو راح يصير stasis، معناها راح يصير عندنا stasis، معناها انه الارتري push to the limb, the blood to the limb by the action of the pumping heart, while the venous return depend on many factors in order to return the blood from the foot, which is well away from the heart and has a limited pressure, venous pressure, and it high venous pressure on the foot to enable blood to be returned against the gravity. احنا قلنا هاي gravity هي اللي مسويه عمود البلاد، يعني column of blood create a pressure on the foot resulting in stasis، يعني ما يصير be flow toward the heart. To negotiate this or to combat this, the calf muscle pump is functioning to augment and pump blood right away to the heart, by pressing on the deep veins located between these muscles and create a pump-like action in order to push more blood or to augment the pressure in this venous system and direct it toward the heart. So the main function or the main principles of preventing venous stasis in the lower limb is by the functioning calf muscle during movement and especially during walking. This photo or diagram represent the deep venous system. هذا deep venous system, femoral vein, popliteal vein, and this is the superficial veins. هذا greater saphenous vein, and this is the lesser saphenous vein. Between the greater saphenous vein and the deep system, there are many perforators, high perforators, mid-type perforators connect the deep system and the superficial system. At the knee joint, also called gastrocnemius perforators, they connect these greater saphenous vein to the deep system. Also, there are lower leg perforators and ankle perforators. So these perforators help to reduce the pressure in the superficial venous system. شلون؟ احنا من واقفين during standing position, the pressure in the venous system is high. ليش؟ لأنه مع طول احنا واقفين، فإذا البريشر هو equivalent to the شنو column of the blood from the heart to the foot. هو هذا البريشر. During walking, during each act of walking, يعني gastrocnemius contraction, it will pump blood. It will compress these deep veins, هذا soleus plexus or gastrocnemius plexus. And the thigh muscles also compress the popliteal and the femoral veins, pumping blood from below above, reducing the pressure. During this reduction of pressure, the perforators, طبعا هذا البلاد الفينز بيها valves، والvalves direct toward the heart. يعني الفالف يصعد ما ينزل، يعني من يصير gastrocnemius contraction البلاد اللي يصعد بعد ما يرجع، another contraction يصعد البلاد بعد ما يرجع، another contraction يصعد البلاد بعد ما يرجع، ولذلك maintain the flow of blood through the gastrocnemius muscle. زين. System during this contraction اكو هاي البرفوريترز الفالف مالتها هم يعني الدايركشن مالتها from the superficial to the deep system، يعني تطبب بلاد من السوبرفيشال للديب سيستم وليس العكس. during each contraction راح ينخفض البريشر هنا بالديب سيستم during contraction. when the pressure in the deep system become reduced as a result of the gastrocnemial or muscle contraction, the pressure is become low. So the higher pressure in the superficial system will make blood to flow through the perforator veins to the deep system, and then another act of contraction will push the blood toward the heart. مفهومة هاي؟ مو صحيح؟ زين. إذا الفالف عندنا مهمة جدا in keeping the flow directed toward the heart and minimizing the pressure within the lower leg in the both deep and superficial system due to connecting perforator, which is one direction valve system. Venous varicose veins. شنو هي varicose veins? Varicose veins is defined or are defined as dilated, usually tortuous subcutaneous veins 3 mm in diameter, measured in an upright position and demonstrable reflex with demonstrable reflex. Factor يعني هي معنى شنو الفاريكوز فين؟ هي عبارة عن dilated, tortuous, elongated, subcutaneous veins اللي هي شنو هي؟ يعني deep low superficial معناها هي superficial veins, superficial system يعني tributaries of the long saphenous and short saphenous vein become dilated and tortuous and become visible through the subcutaneous tissue or the skin. Factor affecting the prevalence: gender, usually more common in women than men. Age, it increases in frequency with age. Body mass index and obesity, usually they are more prevalent in obese patient and tall patient. Pregnancy appear to increase the risk of varicose veins. Family history also has varicose veins or some degree of familiar tendency. Occupation and lifestyle, يعني they are more common in individuals who is work in a standing position. ومن نشوفها هاي بالteachers and the barbers، حلاقين والمعلمين، لأن على طول يوقفون وما يمشون، لا هو قاعد ولا هو ماشي، فالبريشر ما طول واقف، يعني ماكو gastrocnemius contraction، فالcolumn of blood exert high pressure result in high pressure in the venous superficial venous system. يعني الperforating vein ما تشتغل، الperforator ما تشتغل زين، في high pressure created in the venous system resulting in dilatation and tortuosity. Clinical features. Varicose vein frequently cause symptoms. The most common is being aching or heaviness in the lower limb, which typically increases throughout the day or with prolonged standing and is relieved by elevation or compression hoistry. Other common symptoms include ankle swelling, itching, while complication of bleeding or superficial thrombophlebitis, eczema, lipodermatosclerosis, and ulceration represent the more important indication for investigations and intervention. يعني عندنا common symptoms هو بالايرلي presentation of varicose veins اللي هو عادة يكون pain or ache during standing during the day, but this pain usually relieved when a patient lie in his bed and elevate his leg in order to reduce the pressure. So related to the pressure, high pressure within the lower limb. Other when complication develop in varicose veins, like bleeding or thrombosis of the superficial veins, or eczema and lipodermatosclerosis, and sometimes venous ulceration. These are the complication of long-standing, untreated varicose veins, and are the main indication for intervention and treatment, surgical treatment for varicose veins. هذه صورة للvaricose vein، تشوفون هذا اللي dilated، هذه dilated tortuous veins. هاي وين هاي صايرة على medial side of the leg، يعني معناها along the tributaries of the long saphenous vein. هاي signs شنو اللي نشوفه؟ The presence of tortuous dilated subcutaneous veins are usually clinically obvious, and these are conformed to the long and lesser saphenous veins, approximately 60 and 20% of cases. يعني more common in the long saphenous vein than the short saphenous vein. And the distribution of varicosities may indicate which superficial system is defective. يعني يا superficial, long or short. With the medial thigh and the calf varicosity suggest long saphenous incompetence. Posterior lateral calf varicosity are suggestive of short saphenous incompetence. يعني الميديال side بنشوف varicosity along the medial side of the varicose veins and the calf muscle. This is related to the long saphenous vein, while lateral مو medial, lateral aspect of the leg represent varicosity of the short or lesser saphenous veins. Other signs which can be found in varicose veins is artelangiectasia, which are essentially a confluence of dilated intradermal venules less than 1 millimeter in diameter. These are maybe mild or severe. وهنا الامبورتنس مالتها انها كوزموتيك، يعني هواي يجون بنات او نسوان هذا يقولون اكو عندنا هاي الاحمرار هذه اللي عباره عن telangiectasic veins in the skin. They are ugly. They cause an ugly appearance in those females. Other name for telangiectasia here يسموها spider veins, thread veins, and hyphen webs. Other signs here, articular veins, they are dilated subdermal veins 1 to 3 millimeter in diameter, and the presence of telangiectasia and reticular veins are of common significance, يعني clinically not significant, but are not necessarily associated with major varicose veins. They are a purely cosmetic problem مثل ما قلت. In saphenous varix اللي هو junction between the long saphenous vein with the femoral vein, عرفونا end of saphenous vein along the upper thigh, usually terminated at the femoral vein at an area called saphenofemoral junction. Sometimes dilatation in this area called saphenous varix. There is a large growing varicosity which present as usually painless lump emerging when standing and disappearing with recombinant. Gentle palpation of the varix produce during coughing may elicit a throat during coughing. Atrophy blanchy is a localized white atrophic skin frequently surrounded by dilated capillaries and hyperpigmentation. These are skin complications of varicose veins, usually seen around the ankle. Corona Phlebitis are fan-shaped pattern of small intradermal veins on the medial or lateral aspect of the ankle or foot. Synonyms include malleolar or ankle flares. Pigmentation, usually brown discoloration because of the hemosiderin deposition. And I mean, عندنا high pressure in the foot. Again, the most, the highest pressure is created in the area of the foot because it because it harbors the highest pressure of the blood column. So the continuous high pressure result in leakage of RBCs to the subcutaneous planes, result in deposition of hemosiderin within the skin and subcutaneous tissue, usually affecting the gaiter area. Gaiter area هي مكان شو اسمه اللي هي يسموها اللاستيك مع الجاروبه. اللاستيك الجاروبه وين يصير؟ على اللور ankle. I may be associated with phlebitis and ulceration. Eczema, this is an erythematous dermatitis which may progress to blistering, weeping, and scaling eruption of the skin. Should not be confused with contact dermatitis because it is related to the varicose veins. And association with dermatitis or eczema is related to the varicose veins. Usually this association can be confirmed as the presence of varicose veins and the site of the eczematous lesion, usually at the lower ankle and the foot. Pitting edema is as a result of an increase in the volume of the fluid in the skin and the subcutaneous tissue, result in some sort of edema in both in the affected lower limb, and it is usually of pitting type. Lipodermatosclerosis is a localized chronic inflammation and fibrosis of the skin and subcutaneous tissue as a result of severe chronic venous insufficiency. Finally, when the skin become chronically affected, result in a frank ulceration of the skin or the lower ankle or the gaiter area. So these are the sequelae of complication of long-standing venous pressure, venous varicose veins. أول شيء pain، ممكن نلقي signs of varicose veins هي dilated tortuous veins، أو نلقي flare، أو نلقي ممكن pigmentation. بعدين يصير long-standing cases نلقي eczematous lesion or lipodermatosclerosis اللي هو thickening of the skin, thicken the skin with brownish, thicken the skin over the ankle. Finally, if the condition is untreated, an area of frank ulceration can develop on the lower leg or the ankle joint. Medial side, usually the medial side is more commonly affected، يعني along the medial malleolus، يعني gaiter area اللي حكيتها أنا. شوفي هذا قلنا عنها تلنجكتيزيا أو فلير، تلنجكتيزيا اللي حكيناها اللي هي مو مضرة كلش، بس represent the earlier sign of varicose veins، والأهم شيء بها هو cosmetic effect rather than يعني dangerous sequelae. هاي cosmetic. شوفوا الرجل كلها مخططة بهذا، وعادة البنات هذا اللي قلنا عليه له pigmentation. شوفوا pigmentation، هذا ال brownish pigmentation as a result of chronic high venous pressure in the leg. هذا ال frank ulceration along the medial side of the leg اللي قلنا عليه resulted from chronic venous insufficiency. When we diagnose patient with varicose vein clinically, we have to send him for complex ultrasound imaging. Then management should be starting who have asymptomatic varicose vein can simply be reassured. Indication for referral for vascular surgeon includes C2 disease associated with bleeding, superficial thrombophlebitis, or symptoms of impairing quality of life, or C3 or to 6 disease اللي هي معكم علاقة بها شنو C2 و C3، بس حفظوها انه when patient of asymptomatic, non-complicated varicose veins, only reassurance and نستخدم عدة جوارب مع الدوالي يسموها compression hoistry. Then if the varicose vein are symptomatic or causing complications like ulceration, pigmentation, chronic pain, then intervention might be indicated, including ultrasound-guided foam sclerotherapy, endovenous laser ablation, radiofrequency ablation, or surgical excision of the varicose veins. Complication of the standard varicose vein surgery. المريض اللي يسوي surgery شنو لازم نعرف شنو complications which are reported up to 20% of patients. Wound infection, nerve injury, especially saphenous vein injury in patients who have stripping of the varicose, removal of the long saphenous vein up to the ankle. It increases the rate of nerve injury of the saphenous vein, nerve. While stripping of the lesser saphenous vein or small saphenous vein result in injury of the sural nerve, which accompany the small or short saphenous vein. And the common peroneal injury had a high incidence of 20 and 40%. يعني sural nerve injury and peroneal nerve injury has an incidence of يعني they have higher incidence of injury when we strip the lesser saphenous vein to the ankle. Sural 20% and common peroneal nerve injury occur in 4%. Venous thromboembolic complication, يعني venous thrombosis, is low, usually account for 0.5% of cases. However, patients who are higher for venous embolism, the surgery should be combined with the standard perioperative prophylaxis against thromboembolism. هسه نجي للأذر ديزيز اللي مهم عندنا بالفينس سيستم هو ثرومبوزس. احنا عندنا شغلتين مهمات بالفينس سيستم، يا اما فاريكوز فينز او فينس ثرومبوزس اللي هو اهم عندنا لانه emergency sometimes. Venous thrombosis is the formation of semi-solid coagulum, يعني blood clot within the venous system and may occur in the superficial system, usually described as a superficial thrombophlebitis, or in the deep system called the deep venous thrombosis or DVT. يعني عندنا thrombosis يا اما بالsuperficial system او بالديسم. The superficial system نسميه superficial thrombophlebitis, which is not very dangerous condition. It is usually easy to treat and has no important sequelae. But the problem is when thrombosis occur in the deep system. Venous thrombosis of the deep veins of the leg may be complicated by immediate risk of pulmonary embolism and sudden death. Subsequently, patients are at risk of developing post-thrombotic limb and venous ulceration. يعني احنا عندنا شغلتين اذا يصير thrombosis بالdeep veins, deep venous thrombosis او DVT، شغلتين، يا اما عندنا الريسك immediate risk انه هاي الثرومبس detachment يصير بيها it will goes through the femoral vein to the iliac veins, then the inferior vena cava, then the right atrium, the right ventricle, then the right ventricle will pump it into the pulmonary artery, causing massive, sometimes massive pulmonary embolism and causing sudden death. إذا هاي الاحتمالية ما صارت ممكن أنه on long standing deep venous thrombosis result in post thrombotic limb and venous ulceration. ليش؟ لأن الديب سيستم كله يصير بيه occlusion ويصير بيه insufficiency ويصير high pressure بعد الفالف اللي كان عندنا ورا كل thrombosis راح الفالف مالتنا will be destroyed and not be replaced by a new valve, destroyed. So the pressure will be significantly and continuously high within the lower limb, resulting in chronic venous high venous pressure, resulting in varicose veins واللي حكينا عليها قبل شويه اللي هي development of venous ulceration وvenous lipodelmatosclerosis وهاي اللي حكينا عليها لانه صار عندنا chronic venous insufficiency. While DVT may occur in the upper limb, it is the leg that gives rise to the vast majority of morbidity and subsequent complication of the upper limb. تصير حالات دي فينا ثرومبوسيس بالupper limb بس كلش قليلة جدا ونادرة. اللور limb هي أكثر أهمية وأكثر more important and more common in the development of شباب اسمعوني؟ الو اسمعوني؟ نعم. فإذا عندنا احنا اللور limb هي most common and the most dangerous site of thrombosis that may carry the risk of pulmonary embolism and its possible sequelae of death. Etiology. شلون يصير الثرومبس بالديب veins؟ There are three factors described by Varicose. واحد عالم اسمه Varicose اللي طبيب هو Varicose over a century ago قبل قرن من الزمان are still relevant and in the development of venous thrombosis. قال ليش يصير thrombosis؟ قال عندنا three factors. There changes in the vessel wall, endothelial damage اللي هو مثل ما تعرفون endothelium it is the يعني the layer of the vessel wall that keep the blood in a liquid state. It will prevent its thrombosis. مو صحيح؟ تعرفون هاي الاندوثيليال لايننج اللي شلون نقول الزحليقه مال البلاد اللي ما تخلي البلاد يصير بستيسس، ما تمنع الثرومبوسيس، تمنع الكوagulation عليه اللي هو intact لازم intact endothelial surface. When the endothelium become damaged by one way or another, this will predispose for platelet and RBC to cause a clot. It will aggregate at the site of endothelial damage, predisposing to clot formation. This is one factor. Second, هو stages the blood flow. من الفاكتورز اللي يخلي البلاد انه not from a liquid state هو continuous flow. Once there is a stasis due to occlusion, low pressure, ماكو contractility بالcalf muscles. احنا قلنا المريض او individual يعني يسافر طياره مثلا، اللي سامعين اللي يسافر طياره في لونج جيرني 12 ساعه 17 ساعه عشان يصحوا حتى بالطياره تجي المضيفه تقول لهم على طول حركوا رجليكم. ليش؟ لانه هاي القعده لفتره طويله مو راح يصير شنو يصير ستيسيس، لانه احنا قلنا الفينوس سيستم باللور ليم اهم عامل بي اللي يخلي البريشر لو ويمنع الستيسيس هو الكالف كونتراكشن، كالف مسل كونتراكشن. صح ولا مو صح؟ إذا long journey, long bedridden patient are usually asked to keep his calf muscle contracted continuously in order to prevent stasis. So stasis of blood within the lower deep veins of the lower limb can predispose to thrombosis of the يعني deep venous thrombosis. Hypercoagulability of blood أو يسموه thrombophilia. المريض اللي هو عنده congenital أو acquired cause that make the blood is more liable to coagulate. Those patients are more liable to develop deep venous thrombosis. There are many predisposing factors for venous thrombosis. The most important factor is hospital admission for treatment of a medical or surgical condition. معظم يعني نشوف احنا دي بي تي بالبيت صار عنده او بالشغل او هو نايم او بالبيت، بس معظم الدي بي تي عاده تصير بالمستشفى لانه هو دخلناه على medical illness or surgical condition. ليش؟ لانه ينام ما يتحرك وعنده كوموربيديتي صايره مثلا كانسر انفكشن، هاي كلها زايد يسوي ثرومبوفيليا in addition to the immobility، يعني ظل نايم بالفراش ما يتحرك كم يوم يصير عنده risk of developing thrombosis. فاذا admitted for medical surgical condition injuries especially fracture of the lower limb يعني ما راح يحركها and pelvis pregnancy and oral contraceptive pills use are other well recognized predisposing factors. Endothelial damage is now known to be critical important. The interaction of endothelium with the inflammatory cells or previous deep venous damage renders the endothelial surface hypercoagulable and less fibrinolytic. Stasis is a predisposing factor seen those with arterial ischemia. So the risk factor for venous thromboembolism occupation factors اللي هي age، كل ما كان الايج اكثر هذا obesity، varicose veins اذا عنده immobility ما يتحرك، pregnancy، puerperium، high dose of estrogen therapy اللي قلناها عليها بالcontraceptive pills. previous DVT همينه اكثر ريسك. هذا اذا عنده previous DVT وطلع من عندها ما عنده شيء، ما يجي اسوي عمليه مره ثانيه ويقول لي ترى انا عندي تخثر قديم، يعني معناها هذا high risk for recurrent or recurrent venous thrombosis. Thrombophilia يعني ذول اللي عندهم higher tendency for thrombosis or coagulation of blood، هسه راح نحكي عليها. disease هسه نجي which a patient factor higher related to the disease or surgical procedure, trauma or surgery, especially of the pelvis or hip and lower limb. Many patient with malignancy, especially pelvic or abdominal metastasis, patient with heart failure, recent myocardial infarction, paralysis of the lower limb, inflammatory bowel disease, nephrotic syndrome, polycythemia, paraproteinemia, paroxysmal nocturnal hemoglobinuria, antibody or lupus anticoagulant, Behçet disease, and homocystinuria. All these conditions result in hypercoagulable state and the tendency to form a clot within the venous system. Abnormality of thrombosis and fibrinolysis lead to an increased risk of مثلا congenital على patient hypercoagulable state اللي هو عنده tendency اللي هو inherited tendency to thrombosis اللي هو congenital deficiency of antithrombin 3, protein C or protein S deficiencies, antiphospholipid antibody or lupus anticoagulant, factor D Leiden gene defect or activated protein C resistance, dysfibrinogenias, acquired antiphospholipid antibody or هذاك congenital، هنا هاي acquired antiphospholipid antibody or lupus anticoagulant. then تحفظوهن كلش مهمات. they are causes, common causes of hypercoagulable state. ما عنده شيء risk factor، لا مسوي عملية ولا عنده venous insufficiency، يمشي الرجال وكل شيء ما بيه وشاب، بس عنده congenital defect or inherited or acquired defect in these antithrombotic mechanisms. defect in the antithrombotic mechanism result in higher risk of thrombosis اللي هو تحفظوهم ذني congenital deficiency of antithrombin 3, protein C, protein S, factor V Leiden protein, activated protein C resistant, and dysfibrinogenemia. pathology الثرومبس هسه نجي صارت في اي حال من الاحوال، سواء immobilization، سواء اكو عنده endothelial damage، سواء عندنا hypercoagulable state، كلها سوينا ثرومبس. when thrombus formed within the soleus veins of the calf initially as a platelet aggregate, subsequently fibrin and red cells form a mesh until the lumen of the vein wall occluded. the coralline thrombus then progress as and propagated loose red fibrin clot containing many red cells. This is likely to extend up to the next large venous branch. يعني كل ثرومبس يصير abnormal foreign body stream، تجي more thrombus more، يصير بيها يسموه thrombus propagation، يعني يمتد بالبروكسيمال وديستال، proximal وديستال propagation يصير. in this situation the embolus arising from the lower leg vein can be detached يعني تفلت من الvein and pass through the large veins of the limb and vena cava through the right heart and lodge in the pulmonary artery. This may totally occlude the perfusion to all or part of one or both lungs. يسمي ذاك الوقت pulmonary embolism. Acute right-sided heart failure can occur with sudden collapse and death. Lung infarction is rare as a result as the lung has a dual، يعني من يصير pulmonary embolism lung infarction يعني gangrene of the lung is rare لأنه عندنا dual blood supply، عندنا من pulmonary artery وعندنا من aorta من bronchial arteries. الكومنست هو شنو؟ البلمونري embolism result in hypoxemia and right-sided heart failure. Diagnosis: the most common presentation is pain and swelling, especially in the calf, usually in one lower limb. However, bilateral deep thrombosis are common, occurring in 30%. يعني 70% unilateral, 30% bilateral. When the swelling is bilateral, deep venous thrombosis must be differentiated from other cause of systemic edema. لأن عندنا هنا عادة لأنه هو unilateral most common، من نشوف bilateral swelling of the limb نفكر أكثر شيء systemic edema rather than embolism. However, it is still present, bilateral venous thrombosis. We should exclude other systemic of bilateral leg edema. The other systemic causes of edema are hypoproteinemia, renal failure, heart failure, and other causes. Some patients have no symptoms of thrombosis and may present with sign of pulmonary embolism. يعني ما عنده symptoms بالleg، يقول ما بي اشياء راسا اجانا شنو؟ اجانا sign of pulmonary embolism هو pleuritic chest pain, hemoptysis, and shortness of breath due to hypoxemia. من نجي نفحصه الليج نلقاها شويه swollen و redness فيها، هو ما حاس عليها، بس احنا we have to examine those patients for pulmonary embolism, especially those patients at risk اللي حددناهم قبل شويه، اللي هو risk patient high risk for pulmonary embolism. for venous thrombosis and subsequent pulmonary embolism. Patient may also develop shortness of breath from chronic pulmonary hypertension. Sometimes leg appears cellulitic and very occasionally it may become white من massive embolism يصير بها white or cyanosed. ذاك الوقت نسميها phlegmasia albadolens and phlegmasia cerulodolens. At that time the leg is usually يعني ماكو venous drainage بعد عندنا من اي مكان، فيصير venous congestion، وبعدين راح هذا venous congestion يصير severe enough to press on the arterial supply, result in gangrene نسميه venous gangrene. Myopathic edema of the ankle, dilated venous surface, stiff calf, and tenderness over the course of the deep veins should be sought. Leg pain occur in about 50% of patients with DVT, but it is not specific. Common signs اللي هو dorsiflex, forcible dorsiflexion بعد لا سووها قبل موجوده قبل as a signs of DVT بعد لا سووها should not be elicited because it is usually not specific. هاي واحد. اثنين it will increase the risk of embolism اللي هي الثرومبس موجوده بالكالف فينز. من نسوي forcible dorsiflexion اللي هو الهومان signs راح يصير عندنا increase the risk of detachment of this thrombus، يعني موجوده هي بالديب فينز of the calf، انت تساعدها تصير هي detachment وتروح بالفيمورال فين والرايت سايد اوف ذا هارت and pulmonary embolism. Tenderness for other hormone side should not be done further nowadays. Tenderness occurs in 70% of patients, but also found in 50% of patients without objectively confirmed DVT. The pain and tenderness associated with it does not usually correlate with the size and location and extent of thrombosis. يعني symptoms with pain does not correlate with the size والlocation and extent. ممكن انه extensive thrombosis or minimal symptoms، وممكن انه small thrombus or severe symptoms. Clinical signs and symptoms of pulmonary embolism occur in about 10% of patients with confirmed DVT. يعني احنا 10% من دول اللي عندهم DVT ممكن انه during examination نلقى عندهم clinical signs of pulmonary embolism. A low-grade pyrexia may be present, especially in patients who are having repeated pulmonary emboli. Patient may have a signs of cyanosis, dyspnea, raised neck veins, اللي هي high signs of pulmonary emboli, fixed splitted second heart sound, pleural rub if they have pulmonary emboli causing right heart strain or heart failure, although these signs may be subtle or lacking. Duplex compression ultrasound examination of these veins should be performed urgently. رأسا من تحس انه انت المريض عنده clinical signs suspecting suggestive of DVT, رأسا it is a duplex ultrasound of the lower leg. Ascending venography is another sign, another test used to confirm or exclude DVT. However, this is largely replaced by the duplex ultrasound imaging. Venography usually show a filling defect of a thrombus is now rarely required because the accuracy and the easiest and the more rapid non-invasive test can be gained by the use of the plec compression ultrasound examination. Pulmonary embolism is diagnosed definitively by computed tomography scanning of the pulmonary artery, which can show a filling defect in the pulmonary arteries. Pulmonary angiogram is rarely required now unless interventional treatment is considered or planned. Radionuclide imaging has now been superseded by the CT pulmonary angiogram and should not be normally used. يعني هسه احنا شنو اذا عندنا DVT diagnosis of DVT اهم تيست نسوي له to diagnose DVT هو شنو الدابلكس ultrasound. عندنا ascending venography كان قديما يسووه هسه مو كلش مهم لانه الدابلكس عوض عنه. اثنين من يصير عندنا pulmonary embolism اهم شيء in addition to the clinical signs and symptoms عندنا pulmonary angiography, CT pulmonary angiogram. CT scan with pulmonary angiogram is the gold standard in identifying the filling defect in the pulmonary arteries. قديما كانوا يسوون pulmonary angiogram اللي هو invasive is now rarely required. بس شو وقت نحتاجها اذا عندنا intervention، اذا نريد نسوي pulmonary embolectomy، من نريد نسوي thoracotomy اذا ماسك pulmonary embolism ونحتاج pulmonary embolectomy نسوي pulmonary angiogram. prophylaxis هسه عندنا احنا ذيك الساعه قبل شويه قلنا اكو high risk patient اللي هو obese patient who taking contraceptive pills, patient with hypercoagulable state, patient who underwent long surgery, patient who have a pelvic fracture, patient have malignancy, patient who have previous DVT. Those are called high risk patient. هذول من اريد ادخلهم surgery او ادخلهم بالمستشفى for surgical intervention. They should have a prophylaxis against further deep venous thrombosis. The patient who have been admitted for surgery can be graded as low, moderate, or high risk. Patient with medium or high risk should be considered for anticoagulation. يعني اللي عنده low risk ما anticoagulation، بس اللي عنده moderate or high risk anticoagulation. Prophylactic method can be divided into a mechanical and pharmacological. A variety of mechanical method has been tried, but only the use of graduated elastic compression stocking and external pneumatic compression have been shown to be worthwhile by reducing the incidence of thrombosis. The pharmacological method هو by use of anticoagulant. The most commonly used anticoagulant هو low molecular weight heparin unfractionated. قبل كنا نستخدم الانفراكشنيت هيبارين، هسه نستخدم low molecular weight heparin therapy given subcutaneously in a single dose daily. هذول الهاي ريسك جروب، هذول الريسك جروب لون المودريت فاكتور والهاي ريسك فاكتور. تعرف انه وين نستخدم we start with heparin, then low molecular weight heparin and conjunctively rapid therapy starting the day, and we are the INR in a constant safe level to prevent further thrombosis and to prevent propagation of thrombus and detachment of the thrombus. Thank you very much.